right, well, hello everyone. I'm Dr. Darlene Lobel. I'm a neurosurgeon. I practice at Manatee Memorial just across the river and Blake Hospital just on the west side of Bradenton. So I had two passions when I was a little girl. One of those was healing, as you might imagine, but the other was music. And when you couldn't find me bandaging up our cats, whether they needed it or not, I was at the piano working on beautiful Chopin or Beethoven compositions. And so I want to share both of my passions with you today. So if we can play this beautiful sonata by Beethoven, I want to encourage you to close your eyes and think about one of your passions while you're listening to the music here. You didn't know you were coming to a music concert today, did you? Let me tell you something very interesting. I used to think these two passions had nothing to do with each other till I started studying. Do you know what you've just done in the last 30 seconds listening to that? In combination, actually, with the vocal exercises. I didn't plan this way, but they could not have done a better job than putting this right before my talk. You have literally just changed the rhythm of your brain in the last 30 seconds. With Parkinson's disease, one of the problems is your brain cells don't talk to each other at a regular rate and rhythm. That's why we put in deep brain stimulators, right? To help them come into rhythm. I did this amazing study up at the Cleveland Clinic. We do the DBS surgery with patients awake, and we played music for them, one of the pieces that you just heard. We played silence for some other folks, and then we played another rhythmic piece of music for others. When we were recording the sounds of the brain cells with either no music or with the rhythmic music, we heard irregular patterns as we expected with Parkinson's. But when we played that piece that I just played you, the brain came in to rhythm and it almost mimicked DBS. Is that amazing? I want to tell you something. This is a premise for this entire talk today, and really for this session. Your brain has the capability and is literally designed to heal itself. Your brain creates new brain cells every single day. Do you know this? You create 4,000 brain cells every day that we know of. From the day you're born, well, there's many more from the day you're born, but until the day you die. We used to think when I went to medical school, your brain stopped growing at the age of 20. Not true. You are designed for growth. The brain has an amazing ability to rewire itself around injury. Individuals that have a stroke, you know what? The adjacent tissue takes over the function of the damaged tissue so you can regain the ability to move, to speak. Your brain is the most amazing organ in the world. Today, I'm here to give you some information, of course. We're here to educate. More than that, I hope that you come out of this talk and out of this day inspired. I want you to have hope to hold on to. And I want you to actually experience transformation. You've already experienced transformation just by showing up, by listening to this music, participating in the vocal exercises, and you've got more transformation coming. Now, I'm here to talk to you, of course, about novel therapies for Parkinson's disease and other movement disorders, and I am going to tell you about deep brain stimulation, and I'm going to touch on a couple of other therapies as well. But I want you to consider that there may be a novel way to look at other therapies that have been around for quite a long time. Dr. Butterfeld mentioned a few of these, and you're going to get some more lectures on these later today. Your diet's actually a therapy, okay? Movement is a therapy. Visualization, I'm gonna go into this. Do you know there's a network of cells in your brain in charge of visualization? It's called the mirror neuron network. Like you look at yourself in the mirror, neurons are brain cells. There's a network of cells that have amazing capability to help you. As doctors, as surgeons, as scientists, we're always looking at the root cause of something, right? We want to fix the root cause. We have very well identified what are the chemical changes, what are the electrical changes that lead to symptoms of Parkinson's disease and other movement disorders. Now, traditional medicine, we as doctors, surgeons, and scientists provide to you medications. We provide to you surgical procedures. We provide to you other therapies that counteract those changes. I would suggest to you that that is a very small way that you can heal. I would instead suggest to you a novel approach that we can and have identified things that you can modify in your lifestyle, activities that contribute to, that stabilize, and that reverse those changes. You know, one of the things I see about patients with Parkinson's disease over these last 15 or so years in practice, it's all about reaction. You get a diagnosis, you react to it, right? That's not how we're designed. We are actually designed to be proactive, and we are giving you an opportunity to participate in that today so that you can leave here with a greater degree of empowerment than you have had before. Now, we know Parkinson's symptoms start when we lose about 80% of our dopamine-producing cells, right, in the brain and the substantia nigra. However, we also know by studying dopamine in other areas that lack of movement decreases dopamine additionally. And you may say, well, Dr. Lobel, of course, you know, I can't move. I have difficulty moving, so how am I supposed to fix that? Well, guess what? I have a solution for you in just a moment, all right? Chaos. Did you know this? This is so interesting. Chaos produces adrenaline. You may have heard of this, right? When we're in a state of stress, your brain releases adrenaline, so gives blood, increased blood to your heart, to your lungs, to your muscles. Do you know what it does right after it releases that adrenaline? It sends a signal to begin to replace the adrenaline, okay? Now, if you have a healthy diet, nutrition, you've given your body good food, it has building blocks to rebuild that adrenaline. But do you know what happens if you don't? Guess what it breaks down? It breaks down dopamine. It breaks down serotonin, and it breaks down oxytocin for its parts so it can recreate adrenaline so you'll be ready the next time you're stressed. Chaos in your life has a major neurochemical impact on you. So we know, and I'm not going to go too much into detail, you're going to get a wonderful lecture later today on nutrition. Your B vitamins increase dopamine. Mediterranean diet, high octanoic acid diet, increase dopamine. Copaiba, cannabis, you're going to hear about, increase dopamine. You're in control of that. Tai Chi, there's been clinical studies on Tai Chi that show improvement in motor symptoms with Parkinson's disease. Even if you do Tai Chi in your chair, it helps. But what about those people that don't feel like they can move at all? Maybe you experience a lot of freezing. What do you do? So this mirror neuron network that I was mentioning to you a few minutes ago, here's what it does. This has been studied since 1988. It was discovered. Your brain cannot tell the difference between whether you are actually moving your arm or you are envisioning your arm moving. It activates the same cells in the mirror neuron network and the same pathways, and guess what? You get a dopamine release just by closing your eyes and imagining your arm move. I did a 1.5 years of research on this topic in Grenoble, France, working with Benabid, and we were able to capture electrical activity in the brain that was powerful enough to light a light bulb, to run a machine, just with the intention to move, okay? So everybody can take time, a little time every day, even if you don't feel like getting up, even if you don't feel like taking a walk that day. And you can close your eyes and walk yourself through it. You're gonna hear me use the word empowerment quite a bit today, and I love that it's actually part of the slogan here for the Expo. I was so excited to see all of the speakers coming through here, and I, as a neuroscientist, said, hey, you know what? This does a lot of great things for the brain. Those vocal exercises you just did, guess what? Release serotonin, which you know what that does? It lowers your stress, lowers your chaos. See? You're already having change and transformation. You're going to hear a talk later today about cannabis. Does many things, but also directly increases the impact of dopamine in the brain. You're going to learn about nutrition and Parkinson's disease, which is those building blocks so your brain doesn't have to break down more dopamine. You had a great talk from Dr. Butterfield. She gave you all kinds of wonderful strategies, right? Do you know what that did? Increased your brain connectivity. You know, there's more than one pathway in your brain related to Parkinson's. One causes symptoms more of tremor, those positive symptoms, and another pathway causes more the negative symptoms, so the slowness and stiffness of movement. When you do these exercises, you get to dictate to your brain which pathway gets activated, okay? It's very powerful how this works. You're gonna hear another great talk this afternoon about a device that will help to not only improve symptoms of tremor and other symptoms, but it will also change the energy state of the brain to a flow state, okay? That gets you out of being stuck and move forward. We're talking about caregivers later today and patient stories, telling your story. You know what that releases? Oxytocin. Oxytocin is a great chemical, does many things, directly reduces levodopa-induced dyskinesias, okay? You're getting a neurochemical makeover today, an energetic makeover today by being here. So we're so glad you're here. Mindset is so pivotal to the healing process. This was a study I did at Cleveland Clinic a few years ago. We measured tremor scores in patients before and after DBS. I did that. And then I would ask my patients, how much do you think your tremor improved? Sometimes I would see, well, tremor went from severe to mild, but the patient would say, nope, my tremor's still severe. We said, well, that's interesting. How do other clinicians look? They agreed with me. The patient didn't agree. We were able to map that to whether they had depression or anxiety. So when Dr. Butterfield is talking about treating these other conditions, it is very, very important. I wrote an article a couple years ago on US News and World Report about rewiring your brain for healing. I encourage you to go take a look at that article. I'm not going to go into it today because it's in depth, but it's going to give you some really powerful strategies to begin to have increased empowerment. I'm going to give you 3 strategies here, and then we're going to talk about DBS. First one is this. You've been told a lot of things about what is possible with Parkinson's disease, what is likely to happen. I'm going to invite you to make a choice to say, you know what? I don't agree with what other limits someone else has set. As soon as you do that, if you ask your brain the question, what if? What if that's wrong? What if? Dr. Butterfield talked about how the data changed, right? We don't know everything, but you have control. Second thing is this. I want you to recognize your identity is not rooted in Parkinson's disease, okay? When you say the words, I am a Parkinson's disease patient, do you know what that does? That activates your identity centers in your brain, in the medial prefrontal cortex, that are in the same area as your goal-directed centers. That means you've now given your brain a goal for the day of what? To be a Parkinson's patient. Be careful what you say after the words, I am. You are so much more than whatever condition you are dealing with. You are created from your values, from your passions. And thirdly, I want you to imagine your life beyond healing. When you closed your eyes a few minutes ago and thought about one of your passions, okay, wouldn't you love to do that again? Set that as your goal, and your brain will work with you. It'll actually bypass what you think you need in order to get there, and it will help you. All right. Let's talk a little bit about brain stimulation as we finish up. Those of you that haven't heard of this, this is placing tiny electrodes deep inside the brain. Basically, is a brain pacemaker, just like a heart pacemaker. When the heart doesn't beat at a normal rate and rhythm, we put in a cardiac pacemaker. With DBS, it's like a brain pacemaker. It delivers electrical pulses to the brain to reduce tremor by about 90%, stiffness and slowness of movement by about 60 to 70%, and cuts medications. We don't think that everybody is a good candidate for DBS. In fact, we have a whole team put together in order to do these evaluations. But when the medicines you're taking are causing more side effects than they are helping, we start to look at this. We do a thorough physical exam, we do lab studies, we look at the MRI of your brain, we see how much you improve when you take dopaminergic medicines, all right? And importantly, I want to be sure that you're healthy enough to undergo deep brain stimulation surgery. It's an awake brain surgery, don't let that scare you. You're asleep for the drilling of the hole, okay? But you get to actually wake up and participate, which is the reason I decided to start doing this surgery so much. Because the first time I saw a lady who had very disabling tremor not be able to write her name. She just wanted to write letters to her friends, right? And she couldn't write her name legibly. And in the OR, we had her do that, and it didn't look good, and then we put it on the stimulator, and she wrote her name beautifully. And she started to cry, because she knew that her life was changing. I want to show you these videos here. We'll start with what it looks like with DBS turned off, so if we can play the left video.
I was like, I'm hoping I get the right date. I was in this fear of like, oh my gosh.
Perhaps.
I'm home with I'm here.
Oh.
My GPS said you take me from my sister's house 55 minutes.
Can we get the videos to play, please?
Yeah.
And then I saw my ETA getting.
And the doors. Oh, it's no problem, but I'm
There we go. Okay, so you can see typical shuffling gait with Parkinson's disease here. No arm swing. And then after, with the DBS on, you're gonna see a remarkable change. Same patient, DBS turned on, you're actually gonna see him getting up out of a chair easily. Look at that. Look at that. And then you're gonna see him start walking down the hall.
Right.
Ready, Karen?
I'm ready.
Remarkable. Remarkable. And this is typical. This is a typical response to deep brain stimulation. Transformative. Okay, thank you. All right. Missed a slide. You can probably take a screenshot of this. I'm not going to go through this in too much detail, but this shows the long-term efficacy with deep brain stimulation. Okay, this is after 15 years. You still experience 75% decrease in dyskinesias, 50 to 70% improvement in stiffness of slowness of movement. Get your medications cut in half. It is a wonderful, wonderful therapy. I do it a little differently than you may have seen before. You may have seen that big head frame that's kind of scary to patients. Well, it was kind of scary to me too. So I said, there's got to be a better way. I found this wonderful company. I've been doing DBS this way exclusively since 2008. You actually have a 3D printed mini frame that we put on your head that shows us where to cut, where to put the leads, and you can have a souvenir to take home after the surgery. You have control of the programming yourself. With some companies, you can actually put the controller on your iPhone if you have an Apple device. Isn't that amazing? Turn your stimulator up, turn it down. This is our team. We work with general neurologists, family medicine doctors, movement disorder specialists, physical therapists, occupational therapists, neuropsychologist. We talk about every single patient. So you have a lot of visits going for DBS. The other thing I want to say is this, because sometimes people think when they get to me, because I'm the surgeon, oh, that means she's going to want to cut on me. No. Many patients come to me for information, and we go through in detail what the procedure looks like. So don't be afraid to come talk to me or another neurosurgeon to do this procedure. It's about information, and we make the decision together. Remember, this is about empowering you. A couple non-invasive options if you're not a surgical candidate, so you can't tolerate the actual anesthesia with surgery. We can do two different procedures. One is a gamma knife pallidotomy, and the other is focused ultrasound. And those have some very good results. They do have some higher side effect profiles than deep brain stimulation. And importantly, this does create a permanent lesion in the brain as opposed to DBS, which is a modulation therapy. So DBS can be removed at any time, doesn't do any direct damage to the brain, whereas this basically makes a tiny little hole in those pathways that can lead to tremor and your other symptoms. So my last thing that I want to say today is to empower you. What are your next steps? And you don't have to answer that after this talk. Answer it after your day today. What information resonated with you the most? You're going to get a lot of information today, but there's a reason each one of you is here, right? Pay attention to that. What inspired you the most? What gave you the most hope? What transformation are you going to choose to focus on? That is where you're going to see the beginning of a new life that you're looking for. Thank you very much.